Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Thank you for tuning in. Welcome to This Just In. I'm your host, Justin Barnes. In these episodes, I bring you the latest advancements in healthcare, strategy, innovation, and leadership. As always, we're broadcasting from the This Just In studios on the Business Radio X Network, the Healthcare Now Radio Network, and the Global Health Podcast Network. Also, excited to introduce and let everybody know that the This Just In Radio Show just returned from broadcasting live from Vive 2026 in LA, and we're on the way to broadcast live from HIMSS 26 in Las Vegas. It's always great to see and collaborate with thousands of our closest industry friends and peers. For this episode, though, my 386th episode, with a very special show dedicated to a new innovation. And this one's from Amazon Web Services. My faithful listeners know that I love this topic and have a true passion for these discussions. Please welcome my very special guest, Dr. Angela Shippy, Director, Senior Physician Executive at Amazon Web Services, AWS. Welcome to the show, Dr. Shippy.
Thank you, Justin. It's a pleasure to be here.
It's great to have you here today. So before we dive in, we are friends. We've known each other for a little while now. But for my audience's sake, where are you calling us in from?
I am in Houston, Texas, where at the beginning of March, the weather is beautiful and it's sunny outside.
Did you guys have how was your winter? Did you have a decent one?
We didn't have much of a winter. I think we had 3 days.
Well, I'm in Florida, in Sarasota, and we had a pretty tough, we had an entire month. Solid 5 weeks. It probably didn't get above 50 degrees, which is maybe 55 degrees, which is that's pretty cold for this area.
Yeah. I mean, certainly you and I can both kind of joke about it, but we know that our friends and colleagues up north, they're having a time right now.
Very good point. Yeah, I'm originally from Boston. So yeah, very good point. So tell us a bit about your background.
I'm an internal medicine physician by training, practiced as a hospitalist for many years, multiple chief medical, chief quality officer roles. And certainly I've been here at AWS for the last 5 years. And there's so many times when people will ask me, how did I end up here? But I'll tell you, I was an end user of technology my entire career, from starting my residency a few days early because we were mandated to use an early version of CPOE, to Palm Pilot champions, to watching electronic documentation actually become part of our everyday workflow as a practicing physician. So it only makes sense I ended up here at a technology company.
No, and it's a great one to have a strong affinity for Amazon and AWS and what you guys are doing out there. I have the pleasure to speak with a lot of your customers, work with a lot of your customers, certainly over the past several years. And again, love what you guys are doing and very excited for this opportunity today. Before we dive in specifically about this new innovation, what do you love most about your position? It's kind of a question I just dropped on you as we were about to start the show. But because I love to ask this question from time to time, but you have a very unique perspective. You work with some phenomenal people internally and externally in the industry. So what are your thoughts there?
What I love every day about being at AWS is, jokingly, people say it's the place where unicorns come to play. Really interesting people, incredible backgrounds who have done so much, and especially here in the healthcare and life sciences space, very passionate about the work that we do. And what I love about my job every day as it relates to customers is being able to have these conversations where we're talking about how do we solve for their biggest problems and how do we work backwards to determine what's going to be the best way to solve them. So that everyday interaction, talking about how we reimagine healthcare, that's what I love about what I do.
Great answer. Love it. So I guess you're launching this new Amazon Connect Health. First of all, tell us why you're launching this, and then what challenges in the patient or provider experience is the platform trying to solve for?
Well, one of the things at AWS, just like I said, we're working backwards from what's really important to customers. And what they've said is this is important to them. They want to be able to verify their patients right when they first call in. They want to schedule appointments quickly. They want to be able to have insights right when the patient's calling. And they want to be able also to have that ambient documentation that makes it a little bit easier, and also looking forward to being able to code accurately and quickly. Those are the 5 key points that Amazon Connect Health can do, and is exactly what our customers said they wanted.
Absolutely. So you talk about the health system and the providers. From the patient point of view, what will change with the healthcare journey as providers adopt this technology?
what our customers tell us is that their patients are constantly saying that access to care is very important to them. So being able to access their provider right when they need them, no matter what time it is very important. So being able to pick up the phone, make that phone call, and that interaction is being provided to them and personalized for them. Verifying who they are, understanding where they've already accessed the system, what appointment they might be calling about. All of that information is readily available now. And it also helps the health system stay in connection with that patient any time of the day or night.
Yeah, I love it. And your timing is perfect, as you guys know, and certainly planned. We're going into hymns here in a couple of minutes, basically. I assume I'll see you in Las Vegas.
You won't see me in Las Vegas, but you will see all of my colleagues who are really excited to talk about this and so much more.
Absolutely. Yeah, no, I know there's a great cadre there of AWS executives. So fantastic. What impact have you seen with the early adopters with Amazon Connect Health?
Well, I'll tell you, one of our customers, UC San Diego, they have been utilizing this early version of Amazon Health Connect. And Amazon Connect Health. And one of the things that they have seen so far is that looking at 3.2 million patients across 45 contact centers, they have seen that they have saved 1 minute per call. So what this means is about 33,000 hours that have been saved in the time spent on calls. That means that that's more direct connection with the patient as opposed to it being spent on an administrative task.
Absolutely. And I assume, I mean, you're going to have, and you guys are, a global AI leader. Can you talk a little bit about some of the AI strategy there? Because I just came off another radio show talking about the importance, and not just at the enterprise level, but I talked to every level. I talked to 1 doctor groups, to 100 doctor groups, $1,000 doc medical groups, all the way up to large enterprise customers. Talk about how AI and maybe agentic AI is helping with this platform, but I think overall bringing more people into the pond and how it can help providers, health systems scale, I guess, to start with.
Well, really what this means is now you have kind of an AI coworker utilizing agentic AI to help take away that administrative burden. No one ever went into healthcare and said, I want to answer more phone calls. What they said is, I want to help people. I want to have that opportunity to make a difference in their lives. So if you look at a customer like NetSmart, one of the things that they saw immediately is that they were able to increase the time that they had for interactions with patients. And so over 6 months that they've been using Amazon Connect Health, they've been able to increase the time, have more conversation. They actually said that it helped them decrease the time in documentation and have more accurate documentation. When you look at something like that, what it means is now you have providers that have more time with patients. Now you have schedules that are working more efficiently. Now you're able to get more patients in. That's a win-win for everyone. And that's where agentic AI is really going to make a difference. It's going to help streamline processes, allow for workflows that are seamless, and help people work at the top of their license, which really decreases burnout and also helps them be a lot more resilient in the work they do every day.
Absolutely. And I think, and our patients deserve this as well. I mean, this is terrific for providers and certainly health systems, but patients and the friction there is a very large frustration for people, me included. I mean, I have been fortunate where I have a good care team, but I tend to track being a little bit healthier and try to stay that way. But trying to access a hospital, trying to call into a call center is one of the most mind-numbing experiences, and it's very difficult. A lot of friction there, not just for the organization, but also importantly, the patient, the person who's pays the bills for the most part. So I guess this is also why I get excited about these types of innovations, is because we're going to limit that friction, increase that engagement, and really help that population. Access is really critical to these organizations. Access is critical to every single organization in the healthcare ecosystem. Let's spend maybe an extra second there on what this really means for the patients. Obviously, scheduling appointments, being verified on their end and eligibility, but also verified for the organizations. They both want that reduction in friction. Do you want to add a little bit more there, just so we can kind of let people know what success looks like?
So what success looks like is the fact that the patient can call in. they can immediately be identified.
Mhm.
The patient doesn't have to repeat the same facts over and over and over because it's right there and available. What is your date of birth? What's your address? When was the last time you accessed the health system? Which doctor did you see? You might be calling in to reschedule an appointment because we see you already have one. Being able to have a conversation about that and not just questioned and answered, but having that agentic experience so that it's seamless for the patient to get them to the next best action and step that they need. That's what's really going to make a difference. And that's what's going to make it easier for patients to access the care that they need when they want to.
Very important. Great. And you mentioned agentic AI. How does this solution differ from other agentic AI offerings in the industry?
I know one of the key components to what we're offering is that it's in the workflow. It's already integrated with the EHR. It's making it really easy for both the clinician as well as the patient to use. And it really sets up an organization who has all of their data together and ready to utilize the tools of agentic AI. That's what's going to be really important, having your data ready to be able to take advantage of these tools.
It's fantastic. So, and maybe I have a follow-up here on the human aspect of this AI, but I guess for my audience, and again, I like to be an enabler. I want to bring education to people, so to move them in this direction, to not be afraid of AI or agentic AI, and really understand, hey, we're all moving in this direction. Healthcare at every level is moving in this direction.
Yeah.
What are some of the benefits that you've seen? I mean, you're knee deep in this as a physician with a leading organization. You work with some of the top customers and the top healthcare systems in the world. What are some of the not only best practices, what are some of the strategies that you've seen that say, you know what, this make tangible benefits from using AI?
What I'm saying is that organizations who are bringing their data together and then taking that data and turning it into making it actionable so that they can utilize this emerging technology. So we've just had an update to AWS Health Lake, being able to bring your data together, then taking that and saying, what do I want to do next? And how do I want to utilize these AI agentic tools? What I'm seeing is the best organizations are thinking about that. They're already saying what's next. So right now, what do we have available for them? We have verification, we have ambient documentation, but we're going to have more that's available to them later. Medical coding that's going to be available, that ongoing with the patient insights that'll be available. So you've got to be ready. You've got to have your data ready to be able to take advantage of that. And that's what I see the most forward organizations doing. They're bringing it all together now so that they can take advantage of all of the technology that's coming out.
Absolutely. And I think that's a good, just a precursor and insight. Those are what, top organizations are doing, but everybody in healthcare needs to be doing this. We just don't want this dichotomy of these great institutions, and then there's a big gap between the other organizations. Everybody needs to be moving this direction, because if you are not, you absolutely will be left behind. You've got to be looking at how AI can enable your organization. If you're ready for the care setting, fantastic. But financially, administratively, I mean, these organizations out there that I've had on the show recently, they save $40 million by deploying AI in the revenue cycle. I mean, this is really important, because we have more margin pressure than ever before in healthcare. So deploying AI. Obviously, we have less doctors, less nurses, more patients, and more complex care. That can only be solved by using this type of technology, AI, agentic AI, these types of strategies. And again, it's not a panacea, but it's absolutely an essential component to healthcare and your strategic motions to navigate the future of healthcare. So I think that's what I love to use as my platform for is talking about this. I know you guys have some specific offerings, and I love it, but I also want to make sure everybody's beginning to understand where AI fits in their care strategy, in their workflow. How, are they in the learning mode? Are they in an implementation mode? Are they in a pilot mode? Are they in a scaling mode? But it's really important, to your point, to be researching this and looking to see the best points for your organization.
Right. And what we've done so many times before is we really want to democratize this for everyone. The opportunity for whether you're a large enterprise in healthcare or a smaller individual practice, this is technology that you can utilize and that you can put in place pretty quickly.
Absolutely. So now I'm going to ask you a really hard question. And I kind of prop this on you right as we were starting the show. But this is my question that I'm asking a lot of the other thought leaders at HIMSS here in a couple of minutes, basically. How do we keep healthcare human in an AI world?
I think one of the things that we'll be looking at is we'll be talking to our customers and we'll be working backwards from what's most important to them. And then that's where we'll apply the technology. So I think that's one way that you keep it really human is that you're working on what's most important to them. So we'll have organizations that will say, we're looking to reimagine the way care is delivered. We'll have organizations say, we want a healthier community. And so that's what we'll be utilizing the technology to help them reach those goals. That's how we're going to keep it human. And I think the other way that we are going to keep it human is when we think about this technology is decreasing the administrative burden. So that means that face-to-face conversation with your provider, looking to each other's eyes and talking about what's going on will be that much easier because of these agentic tools.
Yeah, I love it. And I'll even give another example. I had Dr. Holomka on my show a couple of times. Well, he's on my show a couple times a year, but recently he said, and then he knows this is controversial. He precursor the conversation with this, a statement with this. If you're not using AI as part of your care strategy in 3 to 5 years, you probably could be sued for malpractice, just because there's so much happening in healthcare and there's just no way that you can keep up. And he goes through the stats. I don't know, how many millions of pages of documentation and new research come out on an annual basis, but it's a lot. And there's no way we can keep up, but technology can, AI can. And so it's just, again, it's important to keep this type of strategy center point on your care. Now, again, it's not replacing anybody. It's augmenting our care across the country and across the world. But it's just the importance of learning what it can do for you, taking it seriously. What would you say to that, though, if you heard John say that?
I mean, what I would say is, as I look to the future, I think breakthroughs in research, reimagining the delivery of care, hands-on patients, thinking about operational efficiency, whatever the new ideas are or the new ways to implement, it's going to be somebody who's got an agent right by their side, right? They've got that coworker and they're utilizing all the tools made available to them through AI and agentic AI. That's where the real breakthroughs are going to happen. So that's what I would say. Those that have agentic AI right by their side, that's who's going to be helping advance the way care is delivered.
Yeah, no, it's fantastic. And it is important. There's so much happening in our organizations. And so having specifically, having these AI tools at your disposal will also allow you to make sure that you're staying current with everything, even as not being the best doctor that you can possibly be, having the most accurate information on your patient, having the most longitudinal information about your patient is critically important. So you make the best care decision, but then also knowing your organization's policies and having those kind of front and center. AI brings all that together in one very simple workflow for most people. So that's what I'm very bullish about that specifically. Looking ahead, where do you see agentic AI having the biggest impact in healthcare in the next few years?
Wow, that's a great question. I would say there's a couple of ways that's going to have a big impact. One is improving operational efficiency. I think everybody would like to be able to see scheduling be easier, making sure their appointments are on time, making sure that the supply chain resources that are needed within the health system are there when they need it. So anything that's helping to improve that operational efficiency. The next opportunity is going to be in the providers. To your point, how are they going to make sure that they have all the information that they need related to that particular patient? What about information that may be new and emerging related to a particular disease process? Being able to have all of that right at their fingertips, right at that chart, at the time of encounter, that's going to be huge. And I think the other opportunity that's going to be there overall is just the goal in taking care of a patient has always been about prevention. The opportunity to take all of this data, bring it together, and be able to have those insights that provide for going further upstream to maybe truly prevent disease as opposed to managing, that's going to be huge.
Yeah, no, and just so, obviously most of my listeners are providers, but in health systems, but I think, as patients, this is what we should be getting very excited about. I mean, having this personalized medicine and in healthcare, and this, when John gets on here, he also talks about, how we're going to have specific drugs developed, basically taken for our specific body and our DNA. And that's, we're not far, this is not the future. We're here today. There's tests that we can do today that will basically allow us to have specific medications built for our body. So our minds are optimal, our bodies function optimally. Because right now we take a lot of medications that are just more generic or for general people. But when you start customizing that to your DNA, that's really when we can, longevity and health and quality of life, all those things really come together. And I'm most excited. This is all on the roadmap for AI. And again, we're not talking 10 years out. We're talking it's here and now in some ecosystems, but also, the next couple of years. I could not be more excited about that coming too.
When you think about what we've seen from a technology standpoint in the last 3 years, the impact that it's having on health and how we deliver care, we can only see that that's going to continue to go farther and farther, faster and faster. I love the quote that I heard at Vive quite a bit, which is, right now, technology and what's happening in healthcare is at lightning speed, and this is the slowest it's ever going to be. I love that. I agree with it. There's so much more to come and so much more that we can do. And my being here today is just to talk about how can we look at this new technology? How can we look at Amazon Connect Health? And how can we say what's going to be different going forward? And how are we going to better improve the way we deliver care to our patients?
That's right. No, I'm very excited for this opportunity and certainly this discussion and what you guys do. Again, I've been able to be a part of and watch what you guys have done, Amazon Web Services and AWS specifically over the last several years. And it's exciting. And I love your customers. To be honest, your team is phenomenal. Your executives, I love your customers too. I get to work with them now on a very regular basis. Many of them are joining the show here in the next day or two. And they're part of my broadcast at Vive and very frequent guests. But you guys have such an innovative group of customers. Unicorns come in there to work and to thrive as organizations, and companies use your platform, but also your customers. It's really cool to see what your customers are doing, and it's really cool innovations. I'm actually going to highlight that a little bit more also coming up, because again, some of your customers are being extremely innovative, very forward-thinking, and it's just exciting to be around. So it's cool.
It is. It really is exciting to be around, and we're taking the cues from our customers on where we want to go next. And so stay tuned to hear more about that. That's going to be great.
Absolutely. So one final question. It is a hard one. And again, I dropped this on you a couple minutes before we went live, but these are the kind of questions that I'm rolling out to other people here in the coming minutes and in coming days. What must we get right over the next 3 years in healthcare and digital health?
What we must get right is really looking to scale. Right now, we're hearing a lot about AI and agentic AI, and it's being used in pockets, but really starting to scale, using across the enterprise for those large organizations. And then for those smaller ones to be able to adopt this technology so that they can use it and have the benefits for themselves and for those that they're serving. So that's really going to be the biggest part, knowing it's here, it's available, it's evolving rapidly, and it needs to be utilized. And we want to make sure that we're democratizing that for everybody so that it can truly be at scale.
I love it. Fantastic. We have about a minute or so more. Tell me about, what shows coming up, conferences or trade shows coming up in March, April, May, June, later on this year that you're most excited about?
Well, we're very excited about HIMSS. All of my colleagues are going to be there. We have a lot to showcase and demo. I would invite everybody to come by our booth. We bring a really large team out to HIMSS. And the reason we do that is because we know that so many of our colleagues are there, both from the United States and globally, internationally, who are coming to see what's happening. So please come by. We want to be able to talk about this update to HealthLake. We want to be able to give you more information related to Amazon Connect Health. We want to talk about what we've already been doing and how you can continue to build. We want to have big conversations about security. That's becoming even more important right now. So I'm really excited about HIMSS. We'll be looking forward to health later in the year as well. And then, as you know, our biggest conference, which is reInvent, that we have towards the end of the year, which is always a great opportunity to hear more about what we have coming up. And so I would invite all of you to reach out to us and also to look forward to those conferences and those events.
Absolutely. Well said. Yes, HIMSS, we're on the heels of HIMSS. And so that's extremely exciting to be a part of. And then certainly, health will actually be on the radar screen for sure. reInvent. And then you guys also have some really cool summits throughout the summer. I think there's going to be one in New York, one in DC. So certainly be looking out for that as well. You guys are always fantastic, great partners. And we'll also I know there's a couple of great sessions. One of my producers, Jake, talked about some of the sessions off air that AWS has at HIMSS. And so I think we'll be sharing some of that too. But Dr. Shippy, thank you so much. As always, you're fantastic.
Thank you, Justin. It's always a pleasure to be in your company.
You got it. And thank you everybody for joining us today, and certainly making us podcast the year last year. We're so grateful. Please tune in as this show broadcasts weekdays at 2:30 p.m. Eastern, 11:30 a.m. Pacific. As always, you can track me on LinkedIn at Justin T. Barnes, or track me on Twitter at HIT Advisor, and use the hashtag ThisJustinRadio to respond to your comments from the show. If you miss any of this episode or want to hear more, all my shows are posted at YouTube, Spotify, Apple iTunes, Amazon Music, Megaphone, SoundCloud, iHeartRadio, and TuneIn. And you can check out the latest content and thought leadership we just posted at justinbarnes.com. Appreciate everybody's time. Thank you so much. Have a great rest of your day.